Good evening, India, and good morning, America and Canada. So I welcome you all, and I would like to invite Dr. Nupur Patnaik to give the welcome address. Dr. Patnaik, over to Dr. Patnaik.
Am I clearly audible?
Yes, you go ahead.
Okay, so good morning to our chief guests, Bob and Jeff, and good evening to the Indian audience. So I am Dr. Nupur from Central University of Odisha. On behalf of the organizer, Center for ADIVASI Research and Development, Bhubaneswar, India, in association with the IIM, that is Indian Institute of Management, Sambalpur, and Central University of Odisha, Koraput, I am delighted to welcome all the participants and viewers to this Zoom meeting, Facebook and YouTube, to the global digital platform of the World Human Sciences and Management Conference. The broader theme of this conference is AGNOTOLOGICAL Context, Disciplinary Practices of Social Sciences and Policy Frames. We believe in the 3Ds: debate, dialogue, and discussion. We are advocating the policy for social change and promoting social entrepreneurship and social marketing. Our prime objective is to preserve the nature, culture, language, and identity of the marginalized people. In this big and challenging purpose, again, I welcome you all to this global digital platform. Thank you. I think you have been muted. Dr. Still has been muted.
Okay. I'm so sorry. I would like to invite Ms. Milanjana to go for the brief introduction of Jeff Melton. Ms. Milanjana.
Hello, everyone. Good evening, India, and good morning, America and Canada. On behalf of Indian people and all the participants and viewers, it's my great honor to introduce Professor R. Jeffrey Melton to the World Human Sciences and Management Conference. In terms of Professor Melton's brief introduction, he is an academic copy editor from Bloomington, Indiana, US, specializing in editing journal article submissions, dissertation, grant school and job application materials, and other academic documents. He has been a full-time editor for 4.5 years now, and a published researcher. He is also a social psychologist who has been widely written about social psychology. He is currently conducting research on cultural influence of the COVID pandemic. He is the co-founder and senior editor of Ocean Editors, and his company does standard editing as well, and advanced manuscript review and scientific consultation with subject matter experts. It's a pleasure to welcome Professor Melton to World Human Sciences and Management Conference. Thank you.
Thank you.
Thank you, Milan. Now I like to request Snigdha, Ms. Snigdha Samal, to go for the introduction of Professor Bob Sinclair.
Hello everyone.
Snigdha.
Good evening India and good morning America and Canada. On behalf of Indian people and all the participants and viewers, I am very pleased to introduce Professor Bob Sinclair to the World Human Sciences and Management Conference. In terms of Professor Sinclair's brief introduction, he is the Advisory Director of Global Mining Sustainability, a non-profit sustainability communications platform for the mining industry. Bob was a lecturer at Penn State and a trainer professor at Central Michigan University, University of Alberta, US, and former full professor of psychology at Laurentian University, Ontario, Canada. Bob has more than 100 peer-reviewed scientific publications, conference presentations, and invited talks He is listed among the 2000 most influential scientists of the 21st century. Bob is a creative imperialist who thinks outside of the box and follows his motto: opinions or hypotheses are guesses and data are facts. When data fail to support your opinions, it is time to change your opinions. It is a great pleasure and privilege to welcome Professor Melton to World Human Sciences and Management Conference.
Thank you
Thank
both
you.
of you. Thank you both
Thank
of
you
you.
very much.
Miss Melanjan and Miss Snigdha Samal. Wonderfully, you gave your introduction about our two guest speakers. Now,
I can also,
before going to
say
listen
that
from
both Jeff and I
Professor
were
Melton
honored
and
to have
Professor
this
Sinclair.
invitation.
Yes. Both. Before going to listen from you, Melton and Sinclair, I would like to invite Professor Sharat Kumar Palita. He is the professor and dean at the Central University of Odisha. He will give the opening remark of our today's topic, the social behavior or medical treatment, which is the more important driver of pandemic at home. I would like to request Professor Palita to give a 2 minutes introductory remarks. Professor Palita. Professor Palita, can you hear me? Professor Palita is, I think he's not here. Okay, so Professor Palita, so sorry, but he's not here. So you go and start. Both I welcome you, both Jeff and Bob. You give the both either 20 minutes each or 25 minutes each, and then we'll go for the debate of this topic. Welcome you both, Jeff and Bob.
Thank you. Can you unmute Jeff too, just in case he wants to jump in and say, okay, perfect. Now I just need to share my screen here. Okay, where's my share screen button on here?
It's in the middle between chat and record. Well, you just move your cursor and it'll bring up the options.
Yeah, I'm just getting record, chat, invite, and participants.
Okay.
That's really odd. Let me see here if I can.
Okay.
Okay, just a sec. Whoa,
screen.
am I still here? Okay, view options.
Yeah.
Okay, now I'm viewing Jeff's screen. That's fine. I don't care. Jeff, why don't you start the presentation, and I'll just say when you feel like going to the next slide, go to the next slide.
Okay. Well, I mean, you go ahead. You were gonna.
Well, why don't you start it as a slide,
so
as a presentation, so that it goes full screen. So go up to slideshow and begin the slideshow. It'll
Okay.
start from the beginning, whatever that or this. Yeah. Perfect.
play from start.
Yeah.
All right. Well, I don't know. Okay.
There we go. Okay, well, it's an honor for both Jeff and I to be speaking with you today. A little bit of background is Jeff and I have known each other for, I don't know, almost 40 years. I think it's got to be close. Jeff and I was in graduate school at Penn State when Jeff was in graduate school at Indiana University, and we used to end up at the same conferences, and we got to be good friends over that time. And we sort of lost touch, and then we started getting back in touch with each other when we realized that people weren't particularly interpreting what was going on with the pandemic properly. So that was the genesis of this research that we're going to talk about today. Okay, next slide, please. One of the issues, there are two sides to what's been going on with the pandemic. And there's the social science side and the medical science side. And in the West, people were focusing on medical science, epidemiology, virology, vaccine development. Although some of that was going on in China too. And, but in the East, people were actually inadvertently focusing on psychology, economics, and political issues, some of which were going on in the West as well. But the problem is there was no synergy, okay? These things were disconnected. And the only way to beat a pandemic is if there's an integration of both, a synergistic integration of both the medical science and the social science. And as you will see, as we go through this presentation, the behavioral aspects of the pandemic have had far more profound consequences on outcomes until the advent of vaccinations. And go to the next slide now.
Let's see. Why can't I?
Okay. So medical treatments have saved lives. Vaccines have saved lives. Public health measures have saved lives. However, our order here is somewhat backwards, because really then of course medical treatments were occurring and people were being intubated, et cetera, and finally vaccines were developed. Okay, next slide.
Why am I stuck? Okay, here we go.
And there are major differences in outcomes between countries and among smaller localities. What I mean by smaller localities is that, for example, we looked within Canada and within the United States, and Jeff will talk about some of our results. I want to point out one thing at this point. We're not going to provide you with a bunch of numbers. We're just going to provide you with verbal descriptions of our results. When we say something was significant, it was. And for those of you who are statistically minded like we are, our partial eta squares throughout all of our research range from 0.30 to over 0.90, okay? So we're accounting for a substantial amount of variance in all of our work, and anything that we say, when we say there was an effect that was statistically significant, we didn't feel like putting in a bunch of means and standard deviations and F ratios and things for it. So if we say it's different, it is. Okay, next slide.
Could I interject something here? From the medical and scientific perspective, scientists know what to do, right? They know that there are certain public health measures that are very effective, and of course, vaccines are very effective. So if scientists were benevolent dictators in the world, we'd have beat COVID a long time ago, maybe even without vaccines. But because of people being humans and the psychology and sociology of how humans act, politicians and the general public do not necessarily listen to what scientists or science says. And the extent to which that's true, as we'll talk about, varies among cultures and among local areas for various reasons. Okay, back to you, Bob.
Next slide.
How is it? Yeah. Okay.
Okay, so why are there these differences? And I apologize for the fact that the right-hand side is a little kind of distorted, but I was trying to get it to fit, and we got the left-hand side. Well, the left-hand side is a drawing that basically represents the West, or almost all of the West. Lots of dead people, okay? And this is, whenever we're talking about rates, we're talking about per capita, or deaths per million, or infections per million, okay? I mean, you know, when people were saying, well, look at what's going on in India. Well, people are forgetting there's almost 1.4 billion people in India, okay? So when you divide these things by 1.4 billion, India is still doing way better than almost all of the West. In the West, you have like New Zealand and Australia that did really well, and Norway, Finland did okay. Denmark, a little bit, but you know, even countries like Canada and Canada did an okay job, but India has far lower death per million rates than Canada does, and infection per million rates than Canada does. So why are we finding these differences? So next slide, please. Well, as I just said, on average, the West did terrible. And on average, all of Asia from east to west did relatively well. Next slide. Okay, so let's look at some of the countries that had poor performance. Belgium, the UK, the US, Spain, Italy, Germany, Sweden, France, Canada, lots of Netherlands, we could go on and on. Let's look at the countries that did relatively well. China, Taiwan, Bangladesh, Vietnam, Pakistan, India, Nigeria, and several other countries that I could list. So take a look at those two lists for a second here.
And
Jeff,
also, we should point out just the magnitude of these differences. So the countries listed there on the left all have had more than 1,000 deaths per million during the pandemic. All of the countries on the right, except for India, have fewer than 100 deaths per million. In some cases, such as China and Vietnam, way fewer than 100 deaths per million. So we're talking about 2 orders of magnitude difference here. It's quite substantial.
And India still wipes out the West. I mean, even though India's numbers are higher, they're still far better than the West. Okay, so next slide. So, you know, what are the differences between these countries? And I got you to look at the lists, and you know, things are churning in your head now. And I think you're probably pretty well aware of what the difference is. Next slide, please. Is it wealth? Is it medical care? Is it population density? Is it median age? Let's think about this for a second. The West has higher GDP. The West has better medical care on average. The West is a little bit less, has a little bit less population density, and the West has a higher median age than the East, okay? So, I mean, you could argue, for example, go ahead, John.
As we know, age is very associated with outcomes from COVID. So younger people are much less apt to die or suffer severe health consequences than older people. So certainly it makes sense to look at age as a possible factor in these differences because the West has a much older population on average than most of the Eastern countries.
Okay, next slide. can these factors account for the differences? And to jump ahead a little bit, next slide. An emphatic no, they can't, okay? So next slide. Psychological / cultural differences can explain, or factors can explain these differences. So as an aside here, I just wanted to, I just wanted to throw something in that you know, Jeff and I were talking about the other day. And, you know, Indonesia is now the epicenter of the pandemic. And I started scratching my head and I'm saying, well, why Indonesia? And then I started going through the data and looking at it. And what I found was, or Jeff and I found, when we were both, you know, babbling at each other in video chats, was that about, you know, between 3 weeks and a month after any religious festivals or holidays or anything that involved gatherings of people, parties, whatever, okay, there were spikes. So in the East, it was like, you know, Christmas, New Year's, I mean, in the West, New Year's, Labor Day, 4th of July, these sorts of things. In the East, what we found was in India, it was after like Holi and the several New Year's celebrations that were going on at about the same time, but at slightly different times in the different states. And this was, this actually had a big effect this year because in January, Modi essentially said, oh, we have the pandemic under control. And India had done really well. They'd gone, you guys had gone up, you'd come down in January. Well, when the leader of your country party and you can go to festivals and you don't have to physically distance and you don't have to wear masks and have a great time. And well, you saw what that turned into. Well, in last year, during Ramadan, all Islamic countries locked down and said, look, you're going to have to celebrate Ramadan at home this year. Well, that wasn't the last year. That wasn't the case this year. So when we look at Muslim countries, on average, we're getting post-Ramadan spikes. And so anyway, just something for you to think about, because one of the things is this is not over. And if people aren't masking and physical distancing, it's never going to be over. Next slide. Okay, here's one of basically our argument is that there are differences between the West and the East. And in the West involves individualism. These are cultures that put their own personal needs and beliefs in their personal freedom ahead of those of society. That's what goes on in the West. But collectivism or collectivist cultures, these are cultures where people put the needs of society ahead of their own personal needs and their beliefs in personal freedoms. And that's the East and much of Africa. You know, South Africa is an individualistic country and it's a mess. Now, I want to make one thing, so there are things that go on that Jeff's going to talk about in a few minutes because he's going to take over speaking at this point. But I want to point out one thing about collectivist countries is that collectivist countries have what's called they have a really large in-group bias. And what that means is that there's great favoritism for your group and protecting your group, okay? And you don't like particularly other collectivist cultures. So let's use Malaysia as an example, okay? Malaysia is collectivist, so is Bangladesh, but Malaysia is more than willing to essentially enslave Bangladeshi workers to benefit their own culture, their own collective. And outbreaks of COVID in Malaysia occurred in these concentration-like camps where they kept Bangladeshi workers. Okay, so Jeff will now, Jeff, you're up.
Okay, can you see again if you can share your screen and do the slides from your end? Because it's kind of a pain to not like, screen sharing turns off anytime I try to look at anything other than this.
Okay, let me see. Okay, okay, share screen. Let me see if I can, tell you what, hit escape, Jeff, escape out of this. Now, I had the ability, okay, more. I think if I do a Control S, I should be able to share my screen. No, we're zoomed here now. Can you still hear me? Am I still there?
Yeah.
Okay.
All right, well, if you can't, then.
Bob,
I'll tell you what, Jeff, why don't you just go back? Because all you got to do is click and you'll hit the next slide.
or you can push Shift plus F5.
Something's reading on my end.
Well, I mean, I guess I can just, I was gonna try to refer to the paper to give more specifics, but that's okay. I can just, go from this.
Well, hang on. Let me try one more time. Okay.
Okay.
Why don't, okay. Let me, I wonder if there's a way. Okay, share screen. You cannot, okay. You stop sharing. Are you no longer sharing?
So, right, yeah, because I was
Okay.
I figured you were gonna try.
Now I'm gonna try now. And let me see here.
Well, I mean, I don't want to interrupt things too much, so if it doesn't work, then it doesn't work.
Why isn't it doing this for me? Okay. Okay.
Well, don't worry about it, Bob. I'll do
Okay.
it.
Okay. Just you'll still have time to refer to the papers, I'm sure.
Yeah. Okay. Okay. So just to continue with collectivism versus individualism, there's variation among collectivist cultures. So, as Bob said, it's very focused on meeting the needs of the in-group, which can be, your whole country. But at the same time, there are countries that have been very willing to help other countries with the pandemic. China and Cuba and Iran, for example, have sent doctors around the world, sent medical supplies around the world, including to the United States, despite the US's poor relations with those countries that I just mentioned. But the distinction that we're drawing here is between countries where it's all about the individual and their rights and freedoms, often to the point of ignoring other people's rights and freedoms. And
actually, believing that their rights and freedoms override other people's. So, for example, I have the right to infect you with COVID.
I don't have to wear a mask or get vaccinated or whatever if I don't want to. Hey, if you're worried about COVID, why don't you get vaccinated? Why don't you wear a mask? You worry about yourself. I'll worry about myself. Why are you so worried about other people? And collectivist cultures are exactly the opposite. They're like, we've got to take care of each other, including our elderly people who are, in this case, most vulnerable to COVID. Our expectation was that this would have profound consequences for outcomes related to COVID and behavior, both government policy and individual behavior related to COVID. And
one of the other issues is that individualistic cultures seem to be very driven by their economies and getting their economies open again. And what that resulted in the West was opening and closing and opening and closing and opening and closing. And in the United States, of course, it just varied from state to state, even varied from county to county. It was insanity. And so when they were talking about waves early on in the pandemic, there were no waves in collectivist cultures, relatively speaking, because collectivist cultures did things to prevent spread of the pandemic, and they didn't have any vaccines. Well, we didn't have any vaccines back then either, okay? But every time you open your economy, you're getting a spike in infection rates, and then you have to close it again. Well, eventually this is going to destroy your economy. And I believe that most collectivist cultures took the approach of, look, we're going to protect our people and get through this. It also turns out that people, as Jeff will talk about in a few minutes, or collectivist cultures are much more likely to support those sorts of measures. Now I'll shut up.
Okay, and of course there are other factors that play a major role in what happens. Obviously, access to vaccinations, but also just basic economic circumstances. So a lot of collectivist cultures that were doing very well in the pandemic, Cuba, for example, many others I could point to as examples, were kind of forced by economic circumstances to open up their economies to, for example, tourism, bringing in lots of possibly infected people. And they're not doing as well now as a result, although they're still doing better than the vast majority of individualistic countries. The other thing that we've looked at that is a very familiar divide that relates to COVID outcomes, to Western audiences, is political ideology. So on one hand, conservative political ideologies, I mean, you could, for one thing, take them as kind of a very extreme version of individualism. Conservative political ideology promotes the most corporate-friendly economic policies, and as we know, Wall Street and so forth are driven by very short-term economic outcomes, which may be disastrous in the long run, as Bob was just talking about, to pursue narrow short-term economic interests. But conservative ideology tends to favor that to a greater extent than non-conservative, whether it be liberalism or more social democratic or socialist or leftist ideologies. And conservative ideologies take individualism to an extreme. More left-leaning ideologies tend to favor the public interest to a greater extent than conservative ideologies do. Although in the West, liberalism is still very individualistic, it's not to the extreme that you find among, for example, Trump supporters in the United States, where everything is about me, screw everybody else, basically.
Or conservative supporters in Canada.
Yeah. So we looked in two other studies at COVID policies and public behavior and outcomes as a function of political ideology. Let's see. Oops, I'm not sure how to go back.
Pressure left. I think it's a left on your mouse. Left mouse click, go back to previous.
Okay. Yeah, all right. Okay, well, I've laid out the conceptual framework. Let me just go to talking about the studies now. So, I'll go back to talking about our first study, which looked across, in most analyses, 130 countries around the world. About 30 of them were individualistic countries, according to Geert Hofstede's definition and rating scale on a scale from 0 to 100, with 100 being the most individualistic. And so individualistic countries, we categorize as those with scores above 50 on Hofstede's scale.
I should let me just interject for a second. We replicated all of our research using regression analyses instead, and we find exactly the same effects. It's just easier for people to look at means and standard deviations than it is for them to look at a comparison of regression equations.
Yeah, so in short, our prediction was that individualistic countries would have higher COVID case and death rates and enact public health measures such as mask mandates and lockdowns and border controls and so forth in a less effective manner. For example, implementing them, or individualistic countries would implement them in a less effective manner. So for example, enacting them too late to slow down the spread of COVID than collectivist countries.
Or they never enacted them at all. Like, for example, You know, a lot of it, most individualistic countries never lock down their borders.
Yeah.
So
yeah, the U.S. being a prime example. Also, that there would be greater public resistance to these measures. You know, in social psychology, we call that reactance, where you react very negatively to any perceived threat to your freedom. So, for example, your freedom to go into public indoor spaces willy-nilly without a mask, or to
in terms of reactance, the idea is that and it turns out that people from collectivist countries experience reactance to a lesser degree than people from individualistic countries. And reactance was originally, the theory was originally developed by a guy named Brehm. And he showed through several experimental studies that when people felt their their freedoms threatened, there are a couple of things that happened. One is that they desired the threatened freedom more, and they acted out more in order to restore their ability to have this particular freedom. Some of these studies were like really simple. There are 3 pencils here, and you can have one, but it can't be the red pencil. And then afterwards, people would evaluate the red pencil as being more desirable, okay? Really simple study, but then, I mean, he got into this in great detail, which would explain a lot of the things that we're going to talk about today. And this even got moved over to what's called the Romeo and Juliet effect, is that parental interference in dating choices, at least in the West, causes the couple who are dating to like each other more and want to be with each other more. So basically, parents should just leave their kids alone. Otherwise, if they say, well, we really don't like him or we really don't like her, it's going to drive the young couples to want to like each other more. Anyway, I'm done.
Yeah. Okay, so we also predicted there would be similar differences, although within a bit narrower range, in COVID cases and deaths, as well as in public health measures and public conduct in relation to those measures. There would be differences as a function of political ideology. So we predicted that conservative US states and Canadian provinces would have higher COVID case and death rates and enact public health measures in a less effective manner and have more reactance and attendant behavior, such as, for example, protests against lockdowns and mask mandates, than more liberal provinces and states.
Or, like in the US, they do things like try and kidnap the governor of Michigan.
Yeah. So one of our predictions, and I don't think we have this on the slide, but we predicted it for conservative versus non-conservative states and provinces too, is that collectivist countries have a greater proportion of their population living with their extended families rather than in nursing homes, because they want to take personal responsibility for taking care of their elderly family members, whereas nursing homes or care homes, whatever you want to call them, are a more common place where elderly people live in individualistic countries. Thus, we predicted that there would be more elderly deaths in individualistic countries,
And infections
also,
too.
to an extent. Yeah, and also same difference, perhaps on a smaller scale, in between conservative and non-conservative led provinces and states, and we found all that. And to be more specific about our predictions regarding collectivist versus individualistic countries, because collectivist cultures are more concerned with protecting their in-group from threats than with individual liberties, we predicted specifically that collectivist countries would implement mask mandates, lockdowns, and border controls sooner and more strictly, and be less likely to ease them prematurely than individualistic countries. And we found support for those predictions. As Bob said, our eta squares were huge, massive statistically significant effects. And furthermore, those effects remain significant when we controlled for things like median age, GDP, and population density. So we definitely found a huge difference in median age between collectivist countries on average and individualistic countries on average. And we did find a relationship between that and COVID rates, although that's obviously confounded with other things like collectivism, individualism. But all our effects remain massively significant when we controlled for any of those things in any of our analyses. Likewise, we expected, due to their greater reactance and concerns, their concern about threats to individual freedom, we predicted that those living in individualistic countries would be more likely to resist mask mandates and lockdowns. And the way we measured this was simply by comparing the frequency and size of protests against such measures in individualistic and collectivistic countries. And we found more and larger protests in individualistic countries. Moreover, the occurrence of those protests was closely associated time-wise with spikes, or rather, the way I should put it is those countries that had more such protests and bigger such protests were much more likely to have spikes in COVID cases and deaths than countries where that wasn't so common.
And we found, and Jeff is going to get to this in a bit, but we found the same thing in Canada when we compared conservative-led provinces to provinces led by other governments. And provinces in Canada would be like states in India and in the United States, and similar effects in the US.
Yeah, okay, well, I'm getting to that. Now, obviously, we do see spikes in some collectivist countries now, India and Indonesia, for example, for reasons that I talked about earlier, just economic reasons, perhaps pandemic fatigue and so on. But last year, when we collected this data, we found basically almost no spikes in cases in most collectivist countries. And so, of course, you'd expect countries that implement more effective public health measures and have populations that are more likely to obey those measures. An extreme example of this being in Hong Kong, where due to the protests that took place there in 2019, the local Hong Kong government actually banned public wearing of masks, and yet people started wearing them anyway, on their own initiative once they recognized that COVID was a threat. And pretty soon thereafter, the local government changed their policy and enacted a mask mandate. But anyway, of course, we predicted that such differences in effectiveness of government policy and in the public's response to the threat of COVID in collectivist versus individualist countries would lead to differences in infection and death rates. And as we already talked about, those differences, in fact, are massive. On the order of 2 orders of magnitude difference in some cases. We also found, because of course, as time goes by, more and more people get infected and or die from COVID in every country. We predicted and found that the difference got bigger over time. So there were pretty major differences in infection and death rates between these 2 groups of countries to begin with, and that difference grew over time. And as I already mentioned, there were also more spikes in deaths and infection rates in individualistic countries. And as I mentioned, in our studies here in the US and Canada, we looked at similar variables and compared conservative and non-conservative states and provinces. Canadian provinces were categorized in terms of whether a conservative majority was in power in Parliament, whereas US states were categorized
in provincial parliament, to be because everything is all health mandates are provincially led in Canada. And this is another issue that we actually didn't talk about, and I'll just throw it in. Countries that had a national strategy did better than countries that the responses to the pandemic were governed at the state or provincial level.
Yeah. And in the US, we categorize states in terms of which presidential candidate, Trump, the Republican, more conservative candidate, and Biden, the Democratic, still conservative, but less conservative candidate, won the state. So in our Canadian study, we found that conservative provinces took longer to introduce mask mandates, allowed more people at religious gatherings, took longer to introduce interprovincial travel bans, or had none at all, were more likely to have high-ranking public health officials, high-ranking government officials, undermine their health officials' advice. So, for example, having a travel ban, and yet flagrantly violating a travel ban that you as a government minister enacted. They had more errors in rolling out vaccines in conservative provinces. They also had more business insolvencies. So, they did less to help small businesses survive the pandemic in conservative provinces. And, same was true of US states.
Well, actually, the other issue there, Jeff, is that let me use the example from Ontario, where we're led by a populist conservative who I expect isn't that popular anymore. And he did things like this. Now, I want to put this in perspective, because I talked at a business school in India about certain approaches to helping stem the pandemic ages ago. And one of the things that I suggested to the government is that I'm a scientist. Why would they listen to me? They're not even listening to their own pandemic response team. Anyhow, they're basically following their own political agenda and ignoring science. And I suggested to the government of Ontario, when our rates of COVID were extremely low, that they isolate Northern Ontario, and I found a method so that there was no interference with the supply chain, okay? And if they'd listened to me, we'd have zero COVID in Northern Ontario now. And then so they didn't listen to me. And then later on, what they did was the Ford government and his reprehensibly incompetent Minister of Health decided that they'd have these zones. And a red zone was where basically you have the plague and everything's shut down, except everything isn't shut down. They pandered to big box stores and corporations at the expense of small businesses when there's absolutely no evidence that COVID is more transmissible in small businesses that follow the rules, as opposed to big box stores like Walmarts and that sort of thing that follow the rules. So they killed small business in Southern Ontario, but they also didn't put in any travel bans in effect. Well, I'll tell you what, is having a lockdown in one area with no travel bans is got to be the most foolish thing you could possibly imagine, because where I live is only about a 3-hour drive north of Toronto, which was a nightmare. And so these people would say, well, look, everything's closed here. It's not that much fun. Let's go up to North Bay on the weekend and party up there where it's green, it's open. Well, of course, they brought all their friggin' COVID with them. And it doesn't take a rocket scientist to say, if you're gonna red zone, put in a travel ban. But you know, like, I'm not a politician, I'm a scientist. What can I say?
Yeah, and in contrast, the Atlantic provinces in Canada enacted very strict travel bans, and they basically have almost no COVID cases, relatively speaking.
But I'd suggested this before the Atlantic bubble occurred.
Yeah. Okay, so to continue with our results, residents of conservative provinces were more likely than those in other provinces to engage in anti-mask, anti-physical distancing, and anti-lockdown protests, and they were bigger protests. And as you'd expect, given all these differences, conservative provinces had higher infection per million and death per million rates than non-conservative provinces, and the differences increased over time. In other words, there was an ideology by time interaction. We also found proportionally more deaths in nursing homes in conservative provinces. And we found essentially the same effects in our US data. Now, bear in mind, both Canada and the US are very individualistic countries that overall performed poorly during the pandemic relative to most of the collectivist countries, especially the US. But there were still performance differences between states or provinces with different political ideologies. And as you may be aware, there are currently major differences between more conservative, political conservative states, i.e. the ones that voted in higher percentages for Donald Trump, and less conservative states in their vaccination rates here in the United States, with some of the more conservative states having vaccination rates under 40%. And in contrast to that, there are quite a few states now that have vaccination rates in the US above 50%. And as you would expect, the spike in Delta variant COVID that's currently going on is overwhelmingly among the unvaccinated, and therefore much more prevalent in the more conservative states that have lower vaccination rates.
Can I just interject for a second? Somebody asked a question here about North Korea and whether we would consider it collectivist. And off the top of my head, it's a dictatorship, but I think the people are collectivist. But we really, we don't have real data from North Korea because it's hard to get data from North Korea. But I expect, given that they, you know, they've isolated themselves from the world, that probably their COVID rates are low. I've also had people asking for our slides, and what we'll do is we'll share the PowerPoint presentation with Samuel or somebody, and he can put it online and you can access it.
Yeah.
Sorry, Jeff.
Well, I mean, I don't think you can really say that North Korea and South Korea are different cultures. It's all Korea.
Yeah, they're collectivist cultures.
Collectivist culture. But yeah, definitely North Korea seems to have isolated itself from the rest of the world pretty effectively during COVID. And so it seems likely that their rates are low. Okay, so in the West, we have individualistic culture and just really kind of an arrogant attitude and this sort of provincialism where they don't even really look at what's going on in, say, Africa or East Asia or what have you, where COVID rates have generally been very low. They could learn a lot from these cultures, but they don't.
All of Asia and most of Africa.
Yeah. And we're basically relying on the vaccines to get us out of COVID, ignoring the importance of public health measures, which have resulted in, for example, China having, with 1.4 billion people, only having had about 5,000 deaths in the entirety of the pandemic. New Zealand, with 5 million people, well, that's an individualistic country and an exception to the rule. But the point is, they took care of their people and didn't let anybody in. So they have
Australia as well.
I think it's about 30 deaths. Yeah, 30 deaths contrasted to what, 20,000 or something like that in Florida, which has maybe 20 million people. So this hubris and this over-reliance on medical solutions has caused an enormous tragedy in the West, needless suffering and death on a massive scale. We should mention, though, and you've probably noticed this if you've looked at the statistics on COVID from country to country, Latin America was somewhat of an exception to the rule of collectivist countries doing better. So countries like Brazil and Colombia and really most of the countries in Latin America have done pretty poorly. Peru has the highest death rate in the world. So they're kind of an exception to the rule that it's a bit of a puzzle as to what accounts for this, because they are definitely collectivist countries. There could be other cultural differences that we haven't looked into driving this, but one important thing to bear in mind is that ever since the Monroe Doctrine in the early 1800s, the United States has regarded Latin America as its backyard. The U.S. Has very often overthrown governments in Latin America. I mean, they've done that throughout the world, but especially in Latin America. So basically, anytime a Latin American country has a free and fair election, as attested to by international observers, the U.S. says, well, the government that won, if the party that won, if it's a party that we don't like, must have cheated, and they try to intervene, and they put sanctions on countries and so forth. So you have a lot of countries in Latin America with governments that are very friendly to U.S. And indigenous corporate interests. And
can I
not
interject
so
for 1 second?
sympathetic to the interests of their own people.
I want to
Sorry
point
about
out
going.
that we never excluded Latin America. We included them in all of our data analyses and coded them as collectivist countries and still get our effects. If we remove Latin America, our effects would be even more massive.
Yeah. So, you know, I mean, this is speculation on our part, but consistent with that, the countries in Latin America that have done best, Cuba and Venezuela, have governments that are largely independent of U.S. influence. The U.S. has sanctions against both of those countries, but their governments do not kowtow to, you know, they don't have American businesses dominating their economies the way in many other countries in Latin America. Another possible reason for this exception to the rule is just you know, the type of leaders that we have in certain collectivist countries and also in many individualistic countries. So Brazil, for example, has done very poorly during the pandemic and is led by Jair Bolsonaro, you know, science-denying populist, you know, very much in the mold of Donald Trump, Boris Johnson, etc. And, you know, it doesn't matter what your culture is if you have a government that basically ignores science in terms of its policies. And unfortunately, Brazil, you know, among other Latin American governments, falls into that category. One thing that we hope to pursue in our future research, and have started pursuing at least in the United States, is differences across countries as well as across states and provinces in vaccination rates and vaccine hesitancy. Now, I'm sure you've heard, or you may have heard, that conservative Trump voting in the United States have much lower vaccination rates than less conservative states. And as I said earlier, the recent spikes in infection rates in the US have largely occurred among you know, the unvaccinated and you know, in Trump voting states and counties. And these people often believe in conspiracy theories regarding COVID and regarding vaccinations. Now, we don't have the data to be able to test that on a global scale yet. We're not able to compare collectivist and individualistic countries in this regard very effectively because we still have a huge problem of vaccine unavailability in much of the global South, you know, which is overwhelmingly collectivist countries. But you know, should we at some point reach a point where vaccines are widely available across the globe, we will be able to do this comparison, and we very much expect that there will be less vaccine hesitancy in collectivist countries than individualistic countries. And so with their higher vaccination rates, collectivist countries will you know, continue to do better in dealing with COVID. As I alluded to earlier, we have a number of examples of countries that did very well in the early stages of the pandemic who have since faltered. And you know, they're still doing better than, in many cases, than Western countries, or you know, in the case of Australia, better than other Western countries. But you know, Australia, for example, is still doing relatively well compared to other individualistic countries in terms of their COVID infection and death rates, because you know, they were very careful in how they addressed COVID with their government's policies. but unfortunately, their government has kind of dropped the ball in terms of procuring vaccines, and they have had people traveling out of the country. So consequently, we have provinces in Australia that are under lockdown because they've had spikes in Delta variant COVID. As some of you are well aware, same sort of thing happened in India, which had one of the lowest rates of COVID infections and deaths in the world. For example, death per million rate well under 100 per million, all of last year. But this year, India has kind of let its guard down and also has a very low vaccination rate. And the result has been a spike in COVID infections and deaths. Now, at least according to the official statistics, India is still doing comparatively much better than, for example, the United States, even a little better than Canada, but it's not anywhere near where it was before.
That's in terms of infections per million and deaths per million. I mean, as I alluded to before, when Modi declared the pandemic under control in January, that was problematic. And the fact that Modi was producing vaccines for export instead of vaccinating Indians is also problematic.
Yeah, they may have expected that they wouldn't need them for a while because they were being careful, but then they kind of stopped. And there are many other countries that have also faltered. For example, Indonesia, which is a collectivist country, currently has the highest per capita infection rates, current infection rates, not cumulative infection rate in the world, I believe, which is an enormous change from the situation there last year or even just a few months ago.
And it's just post-Ramadan too, by the way.
Yes, Indonesia is an overwhelmingly Muslim country, so the spike is very much a result of Ramadan gatherings, it appears. Okay, so now we have these vaccines, which are enormously effective, and I think approaching a couple billion doses have been administered, but overwhelmingly that's taken place in the wealthy Western countries that have mostly developed and produced the vaccines. A few exceptions to the rule, like Cuba and China, have also produced vaccines, and China is pretty far along in their vaccination campaign. But Western countries have mostly hoarded these vaccines for themselves, for their own citizens, and are not, as you might expect from an individualistic country, they're not trying to distribute them on a global scale to anywhere near the extent that, for example, China is. So there are dozens of countries that have hardly vaccinated anyone with even one dose, while meanwhile the US and Canada have around half of their populations fully vaccinated. And yet, in the West, there's been a push by some of the pharmaceutical companies and some politicians for booster shots, i.e. a third dose for some individuals who are already fully vaccinated, or perhaps everyone. How is it ethical to promote third doses in the West when there's so many countries in the global South that can't even access first doses for the majority of their population? And if you look at it objectively, strictly from a public health perspective, this sort of selfishness with the vaccines is not going to quell the pandemic. The only way that we're going to get this under control is to very much limit the number of infections so that there's less opportunity for COVID to mutate into a variant that might be more vaccine, that might escape vaccines to a greater extent than any variant so far. The only way we're going to reach herd immunity is to vaccinate on a global scale.
And we did that with smallpox.
Yep. Yeah, so it can be done. It has been done before, but it's not being done right now, and that's very unfortunate and could come back to haunt us. So, in conclusion, in the West, we have relied on medical science and ignored social science, or, as is often the case when politically expedient, ignored both of them. So you have the UK yesterday opening up its economy, full-blown, not even any mask mandates anymore, despite the warnings of now more than 1,000 scientists who have signed on to a letter to the Lancet, I believe it was, saying, look, this is grossly irresponsible. You can't just rely on vaccines, even with, 60% of the UK fully vaccinated. You're still going to have COVID raging out of control if you don't take public health measures to limit the spread. And the government of Boris Johnson is just completely ignoring scientific advice. The West has also failed to attend to the successes of developing nations, as I mentioned, some of whom performed exceptionally well, even though they're typically poorer countries with poorly developed healthcare systems. Obviously, countries like China being an exception to the rule in the global South, but you have many African countries, for example, that are the opposite of wealthy and don't have extensive universal health care or anything like that, but they've been very careful.
And in India, you've got a two-tiered healthcare system, right? Where you've got private hospitals and you've got public hospitals. And my understanding from my Indian friends is that the public hospitals aren't terribly nice places. In Canada, we have universal health care and all of the hospitals are reasonably nice places.
Yeah, so the paradox is that all of these countries, in the West that have universal health care, the United States being, the only exception to the rule, really, but all these countries that have fabulous healthcare systems that are available to everybody have done absolutely terribly in dealing with COVID. And the reason why is, in our opinion, largely because of culture, their cultural individualism.
And focusing on and relying on science instead of the social science aspects of the pandemic. Many countries didn't, like in Ontario. They'd put in these mandates that no one would enforce. Well, if it's not going to be enforced, why even have it? So, I mean, these things have to be enforced. And that's not, I shouldn't say when I say in Canada, I mean in the provinces and mostly the ones led by the conservative governments. You have to understand, because it's a parliamentary system. The federal government in Canada does not dictate what the provincial governments do health-wise. They just supply them with money and vaccines, okay? So don't confuse Justin Trudeau, who's our prime minister, who has actually done a very good job during the pandemic, with Doug Ford, who's the conservative leader of Ontario, who's done an absolutely reprehensible job.
Yeah. So, to achieve a permanent solution to COVID, obviously, as I mentioned, we have to focus on providing every nation on Earth with sufficient vaccines to vaccinate the majority, really the vast majority, with the more infectious variants around other populations in order to dramatically reduce infections. Now, if more cultures were like China, Taiwan, Vietnam, some other countries that enacted very effective public health measures, New Zealand being the exception to the rule among the individualistic countries, we could wipe out COVID without vaccines. China pretty much did. But obviously, governments and individuals in the West are not going to go along with that. So we really need to vaccinate everyone we can in every country on the planet in order to get past COVID.
And okay, if you look at Thailand, Thailand did extremely well, and they had no vaccines. They just locked down the country. They were sitting at about 1.3 deaths per million people for most of the pandemic. And recently what's happened is Laos, they've had people illegally crossing the border from Myanmar, and that makes sense because no one wants to be in Myanmar right now where there's a genocide and a war and all this sort of thing going on. And for some reason, there have been people coming in from Laos. So their infection per million rates jumped up to 70, but that's still, on a relative scale, that's still not bad. So does anybody have any questions?
Thank you. Thank you both Melton and Bob. Thank you so much for presenting for about an hour. And there are so many questions in the chat box. Before going to the chat box, I'd like to thank you both Melton and Bob. And I'd like to ask Dr. Patnaik, Nupur Patnaik, give a comment on this topic. Dr. Patnaik. Nupur, can you hear me?
Yeah. Thank you so much.
Give a very brief comment within 1 to 2 minutes. Wow.
So thank you so much, Bob sir and Jeff sir, for coming all the way and giving a very important discussion. And it's highly relevant today as we are passing through the pandemic times, and we are crossing this, we will be reaching to the post-pandemic time. So I think this is a very important discussion that you have made, and it was really indeed a very debatable topic, and you have given adequate justice to the topic, and it was really incredible. So your topic on social behavior or medical treatment, what is a more important driver of the pandemic outcome? So it was indeed a very relevant topic, and it was really necessary, because the behavior of the people, though we have the innovations in medicines or technology or many more things, but still the behavior of the people, how do we change the behavior of the people towards the COVID victims, and how do we address this issue? You have elaborately mentioned it in your discussion and presentation. So here, as we all know, that COVID-19 pandemic presents a massive global health crisis. And with the health crisis, we encountered numerous behavioral change that starts from the psychological to the social to many forms of emotional changes that people have gone through. As you have described about the individualistic and the collectivist tendencies that are operating, like how the individualistic countries, how they had their own notion of getting rid of the pandemic, and how the collectivist countries have their own way of getting rid of the pandemic, how the ideologies of conservatism and leftism or the liberalism ideologies have roost during these times of pandemic. And as you have also mentioned about the vaccination purposes, as how people have developed a vaccination hesitancy, like people with like, if we see the cultures, how the cultures are there, and how different people have their own way of taking the vaccine, and how to get rid of that particular thing. And also you have rightly observed the phenomenon of the individualistic countries, where people think about themselves only. They started opening of shops and opening of everything, because they thought that it would be a loss to their economy. And in that case, the spike in COVID cases happened. So that was what you have said it, and it was rightly seen and observed in many countries, and that was the resultant of many problems or the COVID cases have increased due to this particular thing. And lastly, you have also said about the ethics of the pandemic and how, many different cultures have proposed different ideologies to take vaccination. Like, in India, we had the celebrity, they came forward and they were taking the vaccines, and how it made people aware about this fact that we have recognized in Indian society, and how we have also created a vaccine, full vaccination in our country. And rightly, you have observed the facts that are occurring, and that were also a hindrance behind the increase or the spike in cases of the COVID. And lastly, I would like to thank you for your wonderful discussion. And it really, the entire audience of the sociology students, of the social science students, and different students who have come forward, they have understood it, and they have really seen this particular phenomenon of social behavior, that how they could, despite of the medical treatment, how there is a need for the behavioral change. That is what is the necessity, and how we could give way to good behavior. That is also very essential to treat the COVID patients. Not only it's the medicines, but it is also a kind of a behavioral change that we should make to get rid of this COVID. So thank you so much, Bob sir and Jeff sir, for your wonderful discussion. Thank you.
It's our pleasure. I wanted to point out one thing, is that people need to remember that one dose only provides about 30% protection. And if it's the Oxford AstraZeneca, when you have 2 doses, it's around 60% protection. So people can't drop their guard. They got to keep wearing their masks. The success of the MNRA vaccines is a little higher. I think they were over-reporting initially. It's probably more like 80% now that they're saying, which is significantly higher than the vector vaccines like the Oxford AstraZeneca. But you still can't drop your guard. You have to wear your masks until it's over. And until the West steps in and actually does the right thing and forces the big pharma to produce vaccines at a reasonable price, and we just donate them to other countries, it's never going to be over. And that's just my opinion. Jeff might have something to say.
Yeah, well, I mean, you mentioned big pharma. As folks know, and we found in our research, there's a lot more conspiracy-minded thinking about COVID and about vaccines here in the West, it appears, than is the case in most collectivist countries. And you see people just having zero trust in either government or corporations, which, on one hand, that's understandable, but on the other hand, they take it to such an extreme. See people say things like, well, you're supposed to be progressive and favor social justice and to understand how corporations and governments screw over people. Why all of a sudden do you trust big pharma? And it's like, well, you drive a car, right? You use a phone, right? So why are you trusting big auto and big phone? It's like they have this obsession with this idea that the pharmaceutical industry, in order to make profits, which obviously it's trying to do, is going to just randomly do every evil thing imaginable, including making vaccines that are unsafe and ineffective. And it's like, well, why would they do that when they can make tons of money, and in fact have been guaranteed big profits if they make a vaccine that's safe and effective? And so, it's not only the more conservative in the United States, Trump supporting people who think this way, but there's also a segment of the left that has this attitude that we can't trust anything whatsoever that certain corporations do, and that makes it very hard to convince people to get vaccinated, which is the only way, given our proclivities to disregard public health measures, it's the only way we're going to get out of this pandemic.
Jeff shared a headline with me the other day. The only COVID infections and deaths in Maryland in the last month were among the unvaccinated. The United States is now in a position, what's that, Jeff?
The only deaths.
Oh, so pardon me, the only deaths were in the unvaccinated. And the United States is now in a second pandemic that involves all of the unvaccinated people. I've got a friend who's a physician in Orange County in California, which is the only like ultra conservative part of California, and he's not a conservative. And he says, Bob, our hospitals are filled to the brim with young people who have COVID and they're intubated. And now Canada, in the conservative provinces have opened up again, and I expect we're going to have the same thing happen in Canada. I'm not stopping wearing my mask.
Yes, really. Yes, thank you, Professor Melton and Bob. And you mentioned so many things, and at the end you mentioned that vaccination to provide sufficient vaccination will provide to the developing country. The pandemic can be the spread of the more and more virus can be stopped. And also there are some of the questions what Satabdi and Manisha has mentioned in the chat box. You can very quickly answer the questions. Bob and Melton, Satabdi and Manisha has asked.
Dr. Lima, can I ask? Hello, Dr. Lima, can I ask one question to Bob and Jeff? Thank you, Bob and Jeff. Such a wonderful presentation you have did. At the point of this critical pandemic time, when you people are talking about this crisis of pandemic and all these issues related to social science and medical science, I noted and I just want to know from you, what is the subjectivity narrations? When we are going to research or data from field, we have some subject kind of research and subjective boundaries beyond, we don't have any beyond across the lines of subjectivity, first thing. And second, if you heard about Mohan Datta's culture center approach related to the care kind of research. And second thing, how many people knows about the pandemic, the social science, this medical science, those are living in forests. They don't have nothing to understand about the very holistic approach of the human science or human narrations. They only believe they are indigenous practices, indigenous medicines. And you talked about the median age, 20, rightly mentioned by someone, 19th century belongs to Europe and 20th century belongs to America. And this 21st century age belongs to media. We people are in media surveillance. Every day Google watches and the maximum people cannot survive with Google and this Zoom platform. This meeting will conducted now should be happen through Zoom or online. Online cannot be connected to a globe in this economic crisis. How do you believe the social science system or this social science or medical science storm? It's my argument of my personal view, the A3, attacking on arithmetic and aeronautic science. If you could realize and understand in a way to our society and to our divinical society, those are minor narrations. Always agenda set by the UNESCO and the West people. You rightly mentioned in your presentation that West always driven East. How many times we tolerate these powers? Tell me.
I'll let you take that, Jeff.
I'm sorry, I didn't hear all of the question.
Can you break the question down just into sort of three quick questions?
Yeah. Or better yet, type it in the chat.
let me ask in brief, how do you relate this pandemic issue in terms of social science research and medical science research? How do you collect data from field? How do you narrate your case through cultural and individualism practice? How many people are living in particular the hill or forest side? They don't even know what is science, what is social science. Yeah. Now you got Bob, I think.
Okay, you know, I mean, in some senses, I mean, our main point was that if people had paid attention to the behaviors that were occurring, and it's a behavioral issue, which is social science, it's not a medical issue particularly, in the East, the West would have done much better. But the way we collect our data is there are a few sites out there, but the best one is Worldometer. And that's where we've been following, what, 133 or 138, I forget, countries around the world. It turns out that there are only about 30 individualistic countries in the world, and the rest are collectivist. Worldometer provides almost minute-to-minute updates, so we can pull off at different dates throughout the pandemic exactly where infection rates were and death rates were for each of these countries. And then we can, you know, put them in regression models or in what we've been using, our mixed model analyses of variance. But now you need to shift away, and we kind of alluded to that, shift away from looking at deaths and infections per million, and then start looking at maybe, you know, weekly infections and deaths as a function of the percentage of the population that's been vaccinated. And so Jeff and I are also talking about, you know, looking at what happens when they do things like reopen their economies when they've got not very many people vaccinated. And as Jeff pointed out, these data are already out there, is in some of the states in the United States that supported Trump, they've only got vaccination rates of, you know, 27%. Well, you know, those states are spiking now. And so what you told me, Jeff, there was one county that had, I can't believe it was some extremely low vaccination rate. It was a Trump supporting county.
Yeah.
What was
it?
Yeah,
there's roughly 10 states right now that have full vaccination rates below 40%, and they're all Trump supporting states. And you know, somebody did a county by county analysis as well. There's roughly 50 to 200 counties in each state. And, you know, overwhelmingly it was counties that voted for Trump that have the lowest vaccination rates. And there were roughly 20 counties that have had full vaccination rates of below 15%. It's just, on the level of, India or, Australia or other countries that have done very poorly. But the reason, obviously, in the United States that certain locales are doing poorly is not because they don't have access to the vaccines, as is the case in many countries, but that their people don't want to take them. They believe all these nutty conspiracy theories about the vaccines, believe that emergency use authorization means that they weren't thoroughly tested for safety and effectiveness, and ranging up to really crazy ideas like the government's trying to implant microchips in you by injecting you with vaccines, as if they couldn't track you on your cell phone anyway. that's the state we're in, you know, and unfortunately, our government hasn't been very effective in developing a public service message that's going to get through to people, explaining, you know, like the biggest reason for hesitancy in getting the vaccine that I've come across is this thinking of, well, they developed it so fast, how can it be safe? And, you know, it needs to be explained to them exactly how we were able to come up with vaccines so fast. You know, the government put so much money into it and guaranteed profits to the corporations if they developed effective vaccines, and they overlapped the clinical trials instead of spreading them out. And the case rates of the infection rates for COVID were so high that they could collect enough data to you know, test its efficacy and their efficacy and safety like that. You know, within 2 months, they had tens of thousands of people in clinical trials for each of the vaccines that they've looked at, because there's just so many people who you know, were infected with COVID that, you know, they could very quickly, in a sample of you know, a few tens of thousands, have, you know, hundreds of infected people who didn't get vaccinated. You know, they got the placebo versus tens of people who got infected, who got the vaccine, and, you know, massively significant difference between the two.
Yeah, I mean, Jeff and I were talking about this like today we're sitting at about 190 million cases worldwide. It's pretty easy to get a massive sample to do a double-blind study when you have so many people that you can use in your trials. Like Lyme disease is a fairly crippling disease, but so few people get it every year that it's really hard to get the thousands of people that you need for phase 3 trials. So we won't have a vaccine for Lyme disease probably until 2025. We already have one for our pets, for dogs and cats, that you can give to them, so they won't get Lyme disease. But it just hasn't got, there are just not enough people who get Lyme disease to actually have the trials. And you don't want to get Lyme disease. I don't know if you have Lyme disease in India or not, but in North America, it's from a tick, that a wood tick. It lives in the woods, and if you go walking through the woods, one of the very small insect. I don't even think it's an insect. I think it's, I don't know. But it's a little bug of some sorts. Anyway, you won't even notice that you're being bit by it. They're tiny, 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 and they transmit Lyme disease. Now, this also relates to something that Jeff might want to talk about one day, is global warming, because where I live, we never had Lyme disease. And it's moved up from the south into the north. In southern Ontario, like near Toronto, okay, throughout my lifetime, I've watched the Zika virus, which is a tropical virus, has moved up from Mexico all the way through the United States and into southern Ontario, and it's mosquito-borne. It hasn't made it up to northern Ontario yet, but it will. And I've watched fauna like squirrels who take over the range of other squirrels and displace them. That is associated with global warming, because these are moving up from the south. They're these large black squirrels, and they displace the smaller red squirrels. And I'm not going to go on and on about this, but that's something you might have Jeff talk about at some point in time, because he's much more knowledgeable about it than I am.
Just put the PowerPoint in the chat for anyone who wants to grab a copy now. Okay, are there other questions or comments?
I think you have answered all the questions. I think if there is a question, you can read out and answer accordingly, or will. Is there any questions? Professor Jeff, is there any question? If there is no question, anybody asked to question, any question or comment?
We were that clear and convincing? I don't believe it.
Bob,
Okay,
I want
thank
a
you.
quick comment from you. Dr. Lima, can I go for last question?
Yes.
Yeah.
Yes,
Professor Bob,
quick question, quick comment.
It's a quick comment for your presentation, and you should answer it if so. How many people are get vaccinated yet, if you have so data? And what about your assumptions related to these sub-minor countries or third world perspective of countries, Africa, Kenya, Zimbabwe, and many others? How could you get immediate relief from pandemic? And what about your assumptions related a bridge between Spanish virus and Chinese virus? What about people are talking in these days, in these modern days particular? If you go back and analyzing the history of Spanish virus in particular 1920 and Second World War term, First World War term to Second World War term, it's nearly covering more than 2 decades. What is your serious assumptions and policy perspective from the global order? Can you brief it?
Jeff, you want to take that?
It can be a long answer. I would like to request both of you just to.
Okay, I'll tell you what really
possible. Well, yeah.
Go ahead, Jeff.
As briefly as possible. Yeah.
Could you please type the question in the chat? I wasn't able to.
Okay, well, I can basically, Jeff, it's basically essentially, how do we compare this to the Spanish flu? And what did we learn? And you know, my response to that is we learned nothing from the Spanish flu, because otherwise we wouldn't have repeated this. And I'm hoping the next pandemic is going to be sooner than later. It's not going to be 100 years difference, okay? So I hope we actually learn something from this and we're much better prepared for the next pandemic. Because, you know, really, although it's extremely deadly, the reason so many people died is because it was so contagious. Imagine if an extremely contagious virus that is also very deadly, okay? Well, you know what's going to happen is anti-vaxxers and people who don't follow the rules are going to die. I'm going to be staying at home wearing my mask and waiting for a vaccine to be developed.
Yeah, like Bob said, we did. You know, I don't think we learned very much from the 1918 to 20 flu pandemic because we repeated all of the same mistakes, at least in the West. And you know, as Bob said, this is something that we're going to face more and more often because of human encroachment on animal habitat and because of animal agriculture. You know, those are the main sources of infectious diseases. You know, they've accounted for basically every pandemic that's happened has been traceable to you know, some sort of animal to human spillover. And of course, you hear these conspiracy theories these days just because the Wuhan Institute of Virology happens to be located in the same city where the pandemic appears to have started. But you know, of course, the majority of the early cases of COVID are traceable to one or another animal market, which are on the opposite side of town from where the virology lab is. And you know, there are all sorts of other reasons for assuming that you know, this pandemic originated just like every other one through some sort of animal to human spillover. And we're only going to become more vulnerable to that as time goes on because, you know, we have these massive factory farms that are breeding grounds for infectious diseases that could spill over to humans. And we have the wildlife trade bringing animals that could have potentially been infected with a pathogen that could be deadly to us, or at least, in the case of COVID, even though, perhaps, between 0.5% and 1% fatality, but also very dire possible health consequences short of death that can occur from this. That's very effectively by governments or by public health officials is, the fact that there are a whole lot of bad things that COVID can do to you besides killing you. There are millions of people just in the United States alone that are still having COVID symptoms months or a year after getting it. So.
But and also, you know what? It could be the other thing we don't know is, there's things like, well, children, it doesn't really affect them that much. Well, what if it's like chicken pox and it remains dormant in your body and then reemerges like with chicken pox, it's shingles. What if it reemerges as a deadly respiratory virus so that the life expectancy of a 7-year-old goes from, in North America, from like, 81 down to 57 or 47 or something. My final thought on this is, and it's kind of a sad one, is when Bigram asked, what did we learn from the Spanish flu pandemic? Well, the other question is, what have we learned from this pandemic? Because in Ontario, where we're led by this idiot conservative leader, Ford, he reopened the economy way too quickly and it spiked. And then they had to close the economy again. And then they reopened the economy again and it spiked. And so I was listening to a very good doctor, a virologist from University of Toronto, who was on CBC, Canadian Broadcasting Network. And he was being asked about well, why did we get this second spike? And he said, because we did the same thing again. So we haven't even learned from this virus. It's like, yeah, the reason this happened is because they did the same thing again.
They're still doing it. Okay, well,
yes.
I don't want to
thank you both of you. Yes, both of you, Jeff and Bob, and thank you so much for joining us. And also, I'm so sorry everybody who couldn't got the answer accordingly what you have mentioned in the chat box. And I would like to ask Ms. Sifra Khuntia for the formal vote of thanks. Ms. Sifra Khuntia.
Yes, thank you. On behalf of all the participants and organizers of World Human Sciences and Management Conference, I express my deep sense of gratitude to Professor Melton from Indiana, US, and Bob Sinclair from Canada for being with us and enlightening us on social behavior or medical treatment, which is the more important driver for pandemic outcomes. Again, thank you so much, Professor Melton and Sinclair, for accepting our invitation from the busy schedule and joining with us in this global digital platform on the way from USA and Canada. We are really thankful and grateful to both of you for your patience.
Okay, is she done?
We seem to have lost her, but thank you very much. We really appreciated the opportunity to discuss our research with you. And we hope that there were some messages that were worthwhile. Thank you from Canada.
Thank you so much for being
Thank
with
you
us.
very
Again,
much.
thank you so much.
Thank you. Have a good evening.